I myself, Professor Rajesh Kumar Sinha. I'm presently heading the Amity Medical School as a Deputy Director and presently overseeing the entire activities of Amity Medical School. My area of specialization includes health informatics and health information management. So today's topic is allied health professionals, scope and career prospects. Before going to the details of scope and career prospect, we need to first understand who the allied health professionals are. I hope you must have even heard the term of allied health and health professions also. These are the two terms which we frequently use it. Earlier, in a healthcare community, people used to use paramedical or supportive professionals. But now, presently, if you see all over the globe, the term allied health and health professionals are in use. We need to first understand who these allied health professionals are. So, as per the Allied Health Professional Council 2018, and for your information, I just want to tell you that Government of India has taken initiative in making a council for allied health and health professionals. And they have defined clearly who the allied health professionals would be. So as per the allied health and health professional councils, they are considered as an associate technician and technologist who is trained to support the diagnosis and treatment of any illness, disease, injury, or impairment, or implementation of healthcare treatment. Whereas health professionals, which is you can say is another term which we use for the allied health professionals, are the professionals who study, advise, research, and provide preventive, curative, rehabilitative, therapeutic, and promotional health services. Now, in a very simpler way, I'll just explain to you who these professionals are. You must have, and all of you must have interacted with a healthcare facility some or the other day. And you must have seen when you approach to a doctor usually ask you the history and do the physical examination and accordingly send the patient to uh, different professionals who support the doctor in diagnosing the case and accordingly the treatment and plan of treatment which is devised by the doctor. So doctor is completely dependent on these professionals. A doctor cannot provide care alone to the patient, and doctor completely depends on the reports, the test, therapies which the allied health professionals provide. So there are n number of disciplines which exist within allied health or health professions. And you can see on screen, there are various disciplines, which some of the important disciplines I have put on screen. These disciplines are physiotherapy, occupational therapy, audiology, speech language pathology, optometry, renal replacement therapy, medical laboratory technology, cardiovascular technology, perfusion technology, respiratory therapy, public health, emergency medicine, dietetics and nutrition, medical imaging technology, health information management, and clinical research. So there are diverse disciplines in allied health. And even you also would have heard of these professionals or some of these professionals, and you would have an interest in joining some of these programs, which you would have thought of taking it as a career. So for your information, I will explain to you who these professionals are and how their services are important in care of patient. So when we say physiotherapy, so the physiotherapists who are trained professionals who makes use of biomechanics and kinesiology, manual therapy, exercise therapy, and electrotherapy to help patients restore and maintain, increase their physical mobility, strength, and functions. And I hope all of you must have heard of these professions. They considered as one of the important, and they work with, especially in all of the domain. We should talk about orthopedics, you talk about neurosciences, you talk about cardiovascular, or cardiothoracic, or you talk about medicine on, and also with the department of clinical psychology or the psychology or psychiatrist. Whereas occupational therapist, which is little different from physiotherapist, but they are also part of rehabilitative professions, and they use the assessment and interventions to develop, recover, and maintain the meaningful activities or occupation on individual, group, or the communities. For example, I will tell you one of the example of occupational therapy. Suppose in an accident, if a patient gets injured and one of the right limb is not working properly, and his daily activities get affected. Now, how these occupational therapists they do? They make people work, or it's the same example I will tell. The right limb is not working properly, which do not allow the person to do his or her daily activities on a proper way. So what these occupational therapists they do? They prepare the low cost assistive devices, manual assistive devices, which allow the patient to do, like for example, they prepare even the splints, different splints. They prepare a simple assistive devices, a low cost assistive devices, which allow these occupational therapists, which allow the patients to, even they are also involved in and as I said, like physiotherapists only, they are also involved in many other disciplines, like if you say talk about medicine, cardiology, neurosciences, orthopedics, and many other departments. They are closely associated with these departments and accordingly work. Where the third discipline, which is audiology, speech language pathology, which is completely related to the department of ENT, which is called as a ear, nose, and throat. And they closely work with department of ENT, where they assess, diagnose, treat, and help to prevent speech, hearing problems caused by accident, diseases, or genetic disorder. For example, you all must have heard of autism, where the child will have a learning disability, or the child will have a disability in terms of understanding the terms and even with the speech, where the audiology, speech language pathologist closely work with. Optometry, yes, you must have seen in the hospitals also, when you go and you have any vision problem, first you come across with the optometrist. Optometrists usually assess your eyes and advise you for proper glasses. And in case of any kind of refractive error or anything is there, optometrists assist you to work with and accordingly correct your errors. Renal replacement therapy, this is a new discipline. You can say maybe of 3 to 4 years. This is in trend, where this has come as a separate discipline under allied health, which actually work with the department of renal or department of nephrology, and they assist the nephrologist in replacing non-endocrine kidney functions in patients with the renal failure. As I mentioned earlier, the allied health professionals are considered as a backbone of any healthcare delivery system, because without them, healthcare professionals cannot do anything. Coming to the next discipline, which is most important, and all of you must have interacted with these kind of professionals: medical laboratory technologist. The medical laboratory technologist you must have or maybe your family members also, or you must have gone with your family members in a hospital. When there is any kind of disease or disease condition, usually the doctors send the patient for the blood investigations. And where the blood investigations are done and who does it, they are the medical laboratory technologist. As I'm stressing again and again the same thing, that healthcare professionals cannot do anything without allied health professionals. So what they do, they prevent, diagnose, and treat the diseases they themselves do not, but they diagnose it. Yes, they assist the doctor to diagnose the case by testing the samples and accordingly assisting the doctor to tell for what the patient is suffering for. Cardiovascular technology, again, this is a separate domain which has come under the allied health very recently. You can say maybe of 7 to 8 years. They closely work with the cardiology and cardiothoracic surgeons. So what they do is they assist the physicians in diagnosing and treating the cardiac patients and peripheral vascular conditions, because they closely work with them and see how the patients are, and especially the patients with the cardiovascular or cardiothoracic symptoms. Coming to the next discipline, perfusion technologist. So cardiovascular technologist and the perfusion technologist, they are one of the key professionals, those who work with the doctor. Even the perfusion technologists, they operate the cardiopulmonary bypass machine during the cardiac surgery, because they consider it as one of the important team member during any cardiothoracic surgery or any cardiopap. So because what they do is they use the bypass machines, and they operate these bypass machines during the cardiac surgery and other surgeries that require cardiopulmonary bypass to manage the patients with psychological status, physiological status. Another important domain is a respiratory therapist, which include treating diseases, infections, and various of cardiopulmonary systems such as lung cancer, asthma, emphysema, bronchitis, and pneumonia. These are the few, and they closely work with the doctor, and their main functions actually lies in the intensive care unit, where they see the respiratory conditions of the patient. They will be there with the patient to assist the patient in coming out with the disease conditions. Another discipline which is most important, which is not within the hospital, which is outside the hospital, and most of these public health professionals, actually what they do is they do the community-based service. They should go and identify the disease condition which is prevailing in the community. So they analyze and develop programs that protect the health of individual families and communities in the especially this example which I have taken is the United States and abroad. Even Indian public health systems are completely depend on the public health professionals, because most of the time what happened is the public health managers, district health authority, and when the national health authority completely depends on the public health professionals, because they are the one who go to the outreach area, try to identify what the patient is or the community is suffering with, and accordingly what they do is they try to implement programs. For example, malaria control program. So suppose in any of the community the malaria is prevailing, and then the government authority, the district health authority, try to understand who these people are, those who are suffering from malaria. So the public health professionals, they go to these outreach community, try to identify the prevalence and incidence of the disease conditions and what kind of program they can implement. So what they do is they come back and suggest this district health authority and try to implement such program to prevent malaria. This is one example. There are n number of community-based activities which and where the public health professionals are actually support, and their support is very much important because they are working with the community. And in community, suppose you take this present COVID-19, what is happening? It is spreading, and who are the one who go and identify, especially if it is in the community, the public health professionals go with all the preventive measures. They go to the outreach committee, try to identify and come back and tell that this number of population or this number of people are affected with the COVID-19, and accordingly what kind of program to be implemented. Sometimes they even conduct the awareness program. This is one of the key professions, that is emergency medicine technologist, which is rapidly growing. Like only few institutions in India offer such program, because they usually closely work with the emergency medicine or the casualty and trauma. And what these professions they do, in case of any casualty, if the moment the hospital gets any information, these professions they go. Most of the time, what happened is during any casualty, taking the patients from the site of incident to the hospital. What happened? Most of the collapses happen because when they take the patients at the place of incident, and suppose a hospital is around 5 kilometers or 10 kilometers from the place of incident. Now, within these 5 or 10 kilometers of distance, when they are taking the patients with the ambulance, what happened? There is a high chance that in case of trained professionals, if they are not there in the ambulance, there is a high chance that the patient may collapse on the way. So what they do, these emergency medicine technologists, what they do is they try to sustain the patient's condition. They will be in touch with the chief medical officers at the casualty and trauma. What they do is they try to speak to them and provide a kind of care to the patient, make the patient stable, and the moment the patient reaching to the emergency and the patient will have professionals at the hospital. Now, next is the assist dietetics and nutrition. Yes, as you all know that as you all know that especially what happened is most of the time when the patient is at the hospital or patient is there in the community, most of the time now, as you know, like most of the population all over the world, they are suffering with the lifestyle diseases. And most of these lifestyle diseases is because what we do is we eat junk food. And when it reaches to a conditions where we suffer with such a condition, so what happened is that the patients suffers a lot. Now, who will provide advice related to the diet, related to the food, the nutritious food? So they are called considered as a dietetics, nutritionist, or the clinical nutritionist. They work very closely with the patient, decide on a day-to-day basis what, suppose if it's a diabetic patient admitted in the hospital. Now the diabetic patient should have a restriction in the food. A diabetic patient cannot eat any type of food. So who decides what kind of food is must for diabetic professionals? So they are called is considered as a dietetics and nutrition specialist. They work in the hospital and they try to identify what food will suit the patient. Next is the medical imaging technologist. Yes, again, as I'm telling again and again, that whenever you visit a hospital, you will see a department called as radiology and or radio diagnosis. What happened? These technologists, they work. They are the trained professionals who work with the all kind of technology related to the X-ray, CT scan, MRI, or ultrasonography, because they are the trained. They are the one who try to take the image of the patient and accordingly try to diagnose the case and assist the doctor in diagnosing the case. Suppose a patient got a fracture and come to the hospital. Now, what is the kind of fracture? Whether it's a complicated fracture or the simple fracture, who will identify? The radiologist. And it is a radiologist, how? With the assistance of medical imaging technologists, because the medical imaging technologists, they take the film of the patient, assist the radiologist and other healthcare professionals to diagnose the case. Third, which is most of the important, one of the important, and it is not related to any kind of clinical. These professions are not considered as a clinical professions, and they are called as a health information management and hospital administration. So what these do? Hospital administration students or the graduates, when they or the professionals, they see the overall administration. They look to issues, they look to issues related or the care of the patient. So to the doctor, stakeholders in the hospital try to identify the issues and discuss with the top management and then try to resolve it. Whereas the health information management professionals, they work along with the doctor and they manage the entire information. Suppose you go to the hospital, uh, suppose you or any other of your relative, and you go along with your relative or any other, when you go to the doctor, what they do is they try to identify your conditions. And most of the hospitals nowadays, they are following and they have health information management professions. So what they do, they assist the doctor in recording the entire information of the patient. So when the next time when you go, all the information will be there with the patient, with the doctor, and they will not ask for what you have come last time or what kind of medicine you have taken. They just simply, and most of the hospital now, they have gone for electronic health records. So what they do is they just see the screen. Your entire patient record is available on the screen. The medical record is available on the screen, and the doctor sees your previous history and accordingly what kind of medication is provided, and then they provide care to the patient. But who is working in the background? Health information management professionals, who is making the job of the doctor easier in documenting or in capturing the patient's data. And another area, and like research is considered as one of the key element in any healthcare delivery system. Now, the present condition, if you see the COVID-19, most of the hospitals, most of the agencies, most of the countries are now involved in doing certain kind of clinical research to identify what should be the preventive, curative, and therapeutic treatment for COVID-19. So where the clinical research professionals assist the scientist in coming out with certain strategies, coming out with certain device, coming out with certain methodology or certain medicines or any kind of treatment regimen which is intended for human use and protect the life of the human. So that is where the allied health professionals play a key role, as I mentioned earlier and during earlier part of my presentation, that without the allied health professionals, healthcare professionals cannot work because their support is much needed, and and without their support, it would be difficult for a doctor to take care of the patient. Now, coming to the kind of program which is available, and you can search also that over the net, because now it's a information intensive environment where you can search the universities and the colleges which offers these programs, and mainly these programs are offered in four categories. Some of the programs are short-term programs, or we say as a vocational programs. And these programs are like a certificate program or diploma program or very short-term program where kind of discipline is introduced to the person, and practically how the system to be operated or interventions to be done, they usually teach, but they are not considered as a formal program. And with certificate and diploma program, what happened, the restriction or the limitation of these programs are the professionals cannot go to the higher positions because they will be limited. They will be considered as at the low level or the last level of the working professionals in allied health. The other programs and the type of programs which are available is a bachelor degree. And most of the universities now in India and abroad, they offer a bachelor degree program on the disciplines which I have explained. And there are many other disciplines. And one of the more important discipline which I mean just somehow missed is nuclear medicine technologists. Nuclear medicine technologists, they are working with, and now since last many years, what people used to, like earlier, these kind of programs are available with the medicine, like MD. But now, because they require a lot of technologists, so it has come as an allied health domain, and now the nuclear medicine technology is considered as one of the allied health domain, which is presently prevailing in India and abroad. And they work with the detection of cancer and the treatment of cancer. And when the patient goes to hospital, especially the cancer patient, when goes to the hospital, a lot of like radiotherapy or hormonal therapy or any other. So what these professionals they do, they usually work with the cancer specialist or the oncologist in detecting the case and accordingly supporting them in providing treatment. Another kind of program, which level of program, which is postgraduate program, and those who wish to pursue higher studies, they can go for the postgraduate program and then work. Some of the students, what they do is they do the bachelor program and then they immediately go for the job. And those who want to pursue the higher studies, they usually go for the post-graduation program. And the next level is those who are interested in research and development, they usually go for the doctoral research. And in India, there are many universities, they offer doctoral degree program in allied health, and what they do is they usually allow these research scholars to work with the scientists and complete their doctoral degree. Now, coming to the most important area where how these professionals can conduct or are having a role in entire healthcare delivery system or entire healthcare sector in the industry. Usually, the allied health professionals, these are the broad category which I have put up. These are the roles which. So the most of these allied health professionals, they join as a therapist in the hospital. Of irrespective size and ownership, some of them work in a public health public hospital. Some of them work in a private hospital. Some of them get associated with the NGOs and non-profit organization. Some based on their interest, as I said, those who go for the higher studies, that is post-graduation and the doctoral degree, they usually go as an educator, the faculty of allied health sciences. And also, as I said, those who are interested in the research, they go for the research and development agencies, and they conduct a lot of research, as I mentioned, clinical research, as I mentioned, in any of the discipline, physiotherapy, occupational therapy, medical imaging. So basically, what the research and development they do is they usually try to identify the new modalities over the existing one, which assist the patient in better recovery and better treatment. And some of them join as a hospital administrator, as I said, hospital, and doesn't mean that he's a hospital administrator. It's some of the other, like the physiotherapist, they can join as administrator of a physiotherapy center or a rehabilitation center, nutritionist and a technologist. Basically, technologists are related to the medical imaging and a few other, like a nuclear medicine technologist or a cardiovascular technologist. So the technologist doesn't mean that they operate they always work with the machine. No, they work with the patient. And the most important thing you need to take care is, if you are choosing allied health as your make sure that your connectivity to the patient is proper, and keep in mind that you would be with the patient. So kind of social skill, kind of human touch is always needed. Now, most of them are, as I mentioned, they go for their engagement is with the hospitals, educational institution, research organization, insurance sectors, and knowledge processing process outsourcing companies. And some of them work as a the rehabilitation center. I can name few, like some of the rehabilitation center are related to autism. So they require a physiotherapist and occupational therapist, even the speech therapist, to work with them and identify the type of case and accordingly treat the patient. And some of them work in the diagnostic centers and diagnostic facilities. For example, like a medical laboratory technologist, medical imaging technologist, they if they are interested to work in diagnostic centers, even the scope is open for them. Now, coming to your career prospect as allied health professionals, and with all the domain which I have explained, and there are many other domain also, but some of the important domain which I have listed out on the screen, and your career prospect would be any of these based on your interest. If you want to be the therapist, you want to be the nutritionist, you want to be the nuclear medicine technologist. The moment you choose a domain, as I mentioned, choose a domain, education, your professional program where your interest is needed. Unless until you have an interest into this kind of profession, definitely you cannot make a career. This profession is not by force, and some other person should not decide on behalf of you that you choose this particular profession. No, it should be your interest. Then only you can go higher. Otherwise, what happened after a certain period of time, you will repent. Why I have chosen this? I would have chosen that. No, that is why I'm telling again and again that it depends on your interest. You should be interested in doing such programs and making that as a career. Keep in mind that. Some of the opportunities, as I said, why I'm telling you that they are considered as one of the important, and the demand of allied health professionals are very high. As you can see, there are two statistics I put up. One statistic is related to the Bureau of Labor Statistics UK, which the Bureau of Labor Statistics, as per the United Kingdom, what they have stated that there is a projected to grow the allied health professionals or allied health career is prospected to grow 12 to 30% between 2014 to 2024, far more than the average of 7% of any other job. Now you see the graph and try to understand that the scope of these professions are very high. As you can see, the list which I have just now explained to you. And as per the Public Health Foundation of India, in India, presently there is a dearth of allied health professionals, and we need a lot. As per the Public Health Foundation of India studies that India needs 65 lakhs allied health professionals. Why I'm telling you that, as I mentioned earlier, that without the allied health professions, the healthcare delivery system itself will get affected. So keep this in mind that the scope of allied health is very high. You talk about any country, whether it's in India, abroad, any other country. There's another report by the Human Resource and Skill Requirement in the Healthcare Sector by Minister of Health and Family Welfare and Government of India. As per them, as you can see the graph, and whichever bar you see, the number, the green bar indicate the allied health and other healthcare professionals which is needed. As you can see the numbers, there is an incremental growth or incremental demand in having these kind of professionals in on healthcare sector. And this is the initiative which allied health professionals related to the allied health profession. Indian government has taken the initiative. So Ministry of Health and Family Welfare has identified this as a profession, and very soon we will have a council for allied health and health professions. As you can see in the right hand side of your screen, this is the bill which has been passed in the Lok Sabha and it is tabled in the Rajya Sabha. Now, Allied Health and Health Professions Bill of 2018, like you must have heard of that Medical Council of India, Dental Council of India, Indian Nursing Councils. They have a councils and they abide with the councils and they need to register in the council and they are called as a registered practitioner. So once the bill is passed in the Rajya Sabha, then allied health and health professionals will have a council, and that will be called as allied health and health professional councils, where each and every professional, those who are there in the working in the healthcare sector as allied health, have to register, and they will be called as a registered allied health professionals. So, as I said, the opportunities is huge. Indian government has understood the importance of allied health, and very soon the entire and you can see in the left hand side of the screen, even there is a model curricula of allied health and health related profession. You can visit these site and you can go through these some of these model curriculum guidelines, model curriculum and the guidelines which Minister of Health and Family Welfare has identified. As I mentioned, that the model curriculum is available, and any program, any institution, those who are starting, they have to follow these curriculums, and this is one of the good initiative which Indian government has taken. This was about the allied health professions. Now, a brief about Amity Medical School. I'm heading the Amity Medical School, and which focuses on, and this Amity Medical School focuses on imparting world-class education to its student and special emphasis on research and innovation by integrating academics with the healthcare industry. So at Amity Medical School, what we have done is we have integrated with a lot of other agencies, hospitals, research organization, which add a top up, which add a value addition, which is considered as a value additions for the students, where they go to these research organizations, they go to these agencies and get trained. And the most important, especially as I mentioned earlier, that allied health profession is a professional program where you need to have a competency to work with the patient. You need to have a competence to work with the healthcare organization and healthcare professionals. And unless until you have a hands-on, your competency will not be built. So always keep in mind that hands-on session is most needed, especially for this particular profession, because you are going to deal with not with a machine. You're an engineer. You are a allied health professional. So you have to work with the doctor. You have to work with the entire healthcare team, and you need to have a competency. And competency always built based on the hands-on, which you have to spend in the lab, clinics, hospitals, and the research organization, where Amity Medical School is committed to do that. We offer, as you can see, the list is available. We offer this kind of program: speech and hearing, optometry and vision science, dietetics, nutrition, medical lab technologists, hospital administration, public health, and the clinical research and stem cell technology. And we also offer bachelor's, a master's program, and also the doctoral program in all the disciplines. And one area which I would say about the stem cell technology is because stem cell work with the disease conditions, try to identify new methodology, new kind of modalities, new medicine, new therapeutics, and they go into the detail of DNA. They go into the detail of the cell structure, try to identify what is affecting the human, and accordingly they treat the patient. They assist the doctor because they are the one who identify. Suppose recently some of the teams of the same technology are working with a COVID-19 test. COVID-19 creating a COVID-19 testing kit, and they have come out with that testing kit, and now they're working for the vaccines. They're supporting the healthcare professionals or the scientists in coming out with the vaccines and coming out with the other modalities where this COVID-19 can be resolved. The condition can be resolved. So the message which I would want to give you is allied health is one of the key profession which is there, which is existing, and yes, the demand of the allied health professionals are very high because all over the country, wherever you speak, you talk about European, Australian, Indian, Asian countries, or any other continent, wherever you go, you will be respected because your job will be respected, and they have high regard for allied health professionals, and anything which work around the healthcare sector or the community, allied health professionals are existing. So this is about what message I thought of giving to you all related to the allied health professionals and the scope and the career prospects. Now it's open to question and answer. Thank you so much.
Thank you, Dr. Rajesh Sinha. It was a very valuable information that you shared with our participants. The first question that I have received is by Anu Panchal. Is nursing an allied health profession?
Mhm.
Is nursing an allied health profession?
Yes.
She's asking.
No.
Yes.
You see that when you consider healthcare, there are three groups which exist, and they make the healthcare team as a team. One is the doctor, another one is the nurses, and third is the allied health professionals. So don't get confused with the nursing. It's a completely separate discipline. So nursing doesn't come under the allied health, or allied health doesn't come under the nursing. These are the two different disciplines in the domain which make this is the clear demarcation between the nurses and the allied health professionals.
Right. The second question that I've received is, what is the career graph that any optometrist can think for?
As I say, the career graph, as I in my one of the slide which I have mentioned about the kind of level of the programs, and it depends what kind of program you are choosing and what is the level of program you are doing it. Suppose you are sticking to only the certificate and the diploma program. What happened is your career growth is very minimal. The moment you go for the bachelor's, yes, little higher. Go for the master's, much higher, and go for the doctorate, it much higher, because doctorate will allow you to do research and you go at any height. But that's what it depends on the kind of program which you choose. And accordingly the career graph goes higher. You can be the chief optometrist, you can be the ophthalmic researchers, you can be a research scholar. It depends on the kind of the program which you choose, the level of program which you choose.
Okay, so the next question is, can you please elaborate more on the scope of after Masters of Public Health?
Yes, public health, as I said, they are working as a healthcare as a public health authority or the public health professionals, and they usually work with the public health authority. And the higher studies, what I would say is the public health professionals basically work with the public health authority, and the career graph in terms, they can do the higher studies, they can go for the research, they can go for the any kind of research and development organization they can work. The career graph is very high, especially. But as I said, there are a number of programs available. This is bachelor's in public health, master's in public health, and doctoral studies. So again, as I said, you can be the public health authority, because some of the students which I know, they are working as a director in the public health. So the career graph is very high.